Hi, I'm Dr. J.V. Srinivas, Lead and Senior Consultant, Department of Orthopedics at Astar RV Hospital, JP Nagar, Bangalore. This is about 61 years old female patient who present to us with a knee pain and inability to walk. She gives an history of road traffic accident 4 years back. In that accident, she sustained a major spine fracture and both are femur fractures, that is thigh bone fractures. For the spine, she underwent a spine surgical fixation, pedicular screw fixation for a vertebral column fracture. Whereas for the femur fracture, that is a thigh bone fracture, she had underwent a plating. It's called what we call the internal fixation of the fractures. This was the initial surgery which she underwent. After some time, the spine fracture healed. The right side, the femur fracture completely healed. On the left side, the femur fracture was very low, for which whatever the fixation, the plating they had done was inadequate or it failed. The fracture failed to heal, patient was not able to walk. Then she underwent another surgery where they removed the plate and replaced with a knee replacement or a total knee replacement. Patient was comfortable for a short period. After that, patient developed a discharging sinus or a pus coming out from the wound. Then patient waited for 6 to 8 months waiting for the infection to subside. Unfortunately, the infection didn't come down. She went to another doctor where they did a 2-stage revision. After this surgery, patient was asymptomatic for 6 to 8 months. Later again she developed infection. She had a pouring pus in this zone and they were trying to maintain her with oral antibiotics and injection. Unfortunately, patient had a fall at home and sustained a fracture in the high part of the femur. The operating surgeon went inside and put a plate here. Expecting the fracture to heal with a revision implant which was infected. This fracture failed to heal because there was infection around this zone. Patient has already undergone 4 to 5 surgeries around this knee and now she came to us. At this point, we decided that this whole femur, the distal half of the femur is avascular because you have a fracture here and the fracture is failed to heal, and distally you have a distal femur replacement, only a small bone is there and the plates were also in place and everything was infected. What we decided to do is a 2-stage procedure. First stage, remove as much as bone which is avascular or a dead bone, remove all the foreign bodies and put a long antibiotic spacer, wait for the infection to subside and then plan for a revision surgery. During our first stage procedure, when we went inside, as we went up to remove the dead bone, we almost removed the 3/4 of the thigh bone. 3/4 of the thigh bone was avascular, it was dead, what we call sequestrum. We had to remove that, we had to remove the plate, we had to remove the entire revision component, that is the distal femur component. And we put her on a long intramedullary nail which we use normally for a tibia fracture. We had to put there and load it with an antibiotic cement. We waited for 3 months till the infection subsides. Then we planned the surgery. The problem in this was 3/4 of the femur I have removed. If I try to replace a component, a distal femur replacement, we need to have a normal bone where I can put a stem there. Unfortunately, she had only 4 to 5 centimeters of the proximal femur where I could not put a stem and fix it with cement and expect stability in this case. So finally, we decided to do a total femur replacement in this patient. The total femur replacement means we replace the hip joint with a proximal component. The middle part of the femur is replaced by a titanium stem and the distal part with a rotating hinge knee, and distally again the stem will go into the tibia. This was the planning we did. We explained the patient that this is the only possible solution and that's the only way she can walk. This implant is only available from German companies. Indian companies don't manufacture this total femur replacement. So we explained them this is very, very expensive implant, almost 10 to 12 lakhs it will cost, the implant alone, apart from the surgical cost, the medicines, bed charges and other costs involved in the surgery. In this case, what we did was, patient was in supine position, we opened the knee, we took out the antibiotic spacers, we prepared the entire tibia, put a stem inside and the tibial component was in place. Once the tibial component was in place, we turned the patient, we went to the hip area, proximal area, opened the hip joint, The head and neck was removed. The proximal part of the femur we maintain with the muscular attachment, because without muscle attachment we cannot do a hip replacement. So what we did is we maintained the muscle attachment and the bone around 5 centimeters. We replaced the proximal femur with a bipolar component to articulate in the acetabulum side. Then we closed the wound, then we turned the patient, then we connected with a titanium stem with a femoral component. From hip to knee we connected. We had to assess the limb length. According to that, we need to choose a titanium rod which connects the hip and knee. So we connected that. Finally, we connected the femur and the tibia with what we call rotating hinge knee. Both the femur and tibia gets connected. It will never get dislocated, never goes into hyperextension or never go into hyperflexion. And mediolateral, all 360 degree stability it will give. Once we have done it, we close the wound in layers, that is the operative area in layers. We kept a drain, waited for 5 to 6 days till the bleeding stops. We removed the drain and then we made immediately patient made to walk full weight bearing on the femur. That is the operative area. Now the patient is recovered well, pain free, walking around. She has an implant from her ankle joint till the knee, and then it goes on up to the entire femur and to the hip. If you see her x-ray, she has an implant from the hip to the ankle joint. Ultimately, the result is very good. Patient is very comfortable, pain free, walking around after 4 years, was bedridden, and the results are excellent. Only to conclude, total femur replacement is the rarest of rare situation in a trauma situation, but it can be done in a hospital like Aster RV with all the infrastructure, surgical skill and the ICU support. Definitely we can do these kind of surgeries and make patient comfortable and make them mobile. Thank you.